Good afternoon, everybody. Today I'm going to be talking about a couple of techniques that can be used both in and outside therapy while working with clients who have experienced some sort of trauma or adverse experiences throughout their life. The techniques are outlined in Babette Rothschild's text. There are actually some grounding strategies which she encourages to be used, again, both in and outside of therapy. The techniques are called the Oasis, the Anchor, and the Safe Place. So just to review them a little bit, the Oasis is actually a tangible activity, something hands-on that you can encourage your client to do. This should be something that they can work on or do in order to build as a new skill and kind of take their mind off of some of the negative experiences that have happened to them. It's generally discouraged to do anything like watching TV or, playing on your phone because your mind can wander. It's really getting out, taking maybe a pottery class, a yoga class, something that's a new challenging experience. And the idea is to separate the feelings that the body felt during the trauma versus the feeling that the body feels while acquiring the new skills. So again, this can be looked at something that's like self-care, getting out, taking a yoga class, going to the gym, anything that you can do to reduce your state of hyperarousal and keep your mind occupied. The second technique that Babette Rothschild talks about is the idea of the anchor. So the anchor is actually a concept that sprang, according to her, from the neuro-linguistic programming, NLP, and then it was adopted in techniques and strategies to use with clients who've experienced trauma. So the anchor is really a tangible idea or, like a memory, like a person from your memory or some sort of experience. It's not supposed to be like an internalized view of yourself, like you're happy or you're confident or, you're achieving your goals. It's really supposed to actually be a tangible memory, a person, a place, an experience, something that you can think about that has a positive memory attached to it. And what Rothschild talks about is using this idea, this positive memory, as kind of like a breaking point during therapy. So if you're doing treatment and the client starts to kind of dissociate or, is no longer, or they're, internalizing, they're dealing with internal stimuli that are bringing them back to their trauma and they're having difficulty kind of being present where you are, you can go ahead and you can ask them, let's put a break on things a little bit. Tell me about so-and-so. So if the experience is really going to a summer swim camp for 6 weeks because that was a child's, way of getting out of the home, being with peers, having a good time, you can kind of talk about, tell me about camp, tell me about your friend there, or tell me about, how it felt while you were swimming in the water. The idea is to really tie it to a lot of the sensory feelings. So you can ask them about the sight, the sound, the touch, the smell. And that is really, again, supposed to reduce their level of hyperarousal. And so then the idea that Rothschild talks about is that you can continue working on therapy and treatment with them. When you bring up those touchy subjects and they have those challenging feelings, you can link it back to one of their anchors, which then lowers their arousal. So that's a little bit of the idea of the anchor. And again, like I had mentioned, each time the anchor is used, the hyperarousal is reduced a little bit. And then the final technique that she talks about is the idea of a safe place. And again, this was a technique that Rothschild reported was originally used in hypnosis. And hypnosis primarily to reduce the stress associated with traumatic memories. And so it's really been adopted again in working with clients who have suffered adverse experiences and trauma. So the idea, again, is that the client, while working on therapy, if they're struggling, will imagine a tangible, as Rothschild says it, an earthly place, someplace on earth where they feel comfortable, they have positive memories attached to that experience, and they can quickly kind of go back to their safe place when they're met with challenges. And again, the idea is to kind of use a lot of somatic sensory ties with this. So asking them, what did it smell like? What was the house like? How did it feel? What color was it? And just kind of asking as many questions to, again, the effort is in an effort to reduce that level of hyperarousal that they're experiencing. Thank you for watching my video. If you have any questions, again, please reference back to my written paragraph, and have a good day.